All right, you guys, thank you so much for being here. This is the 8th annual A Time to Remember, or a Night to Remember, A Time to Act. Ugh. This is a very special event because we get to take time together to remember those who we have lost to this disease. So many of you are here tonight because you have lost somebody to this disease. You've lost somebody you love to an overdose. And some of you are here having had that loss very fresh. And I just want to remind you that there are people here who will help you and support you and love you through this. And you are not alone. You are in the right place. And we are glad that you are here. That is why we do this event. Just a couple of things. I wanted to thank a few people. I wanted to start with I wanted to thank Steve and Isabel from Modern Home Furniture for supplying this amazing stage set. Steve and Isabel, are you guys still here? Can you guys raise your hands? Everybody give them a round of applause, please. So thank you for sponsoring us in this way. This is so special. We get to really have a really meaningful conversation. And I also wanted to thank, again, Snohomish County government and Dave for their tireless partnership for continuing to help us have a successful event every year. And also, can we please give a round of applause for all 30 plus resources that showed up today to bring you guys support and services. Unbelievable. We've never had a turnout like this before, and we're so grateful. We also, on the event programs, as you guys walked in, Kaylee, I don't know where you are, but Kaylee, thank you so much for being our greeter. Kaylee lost her mom to an overdose and she wanted to get involved. And so she has been our welcome committee at the front, and you will have gotten an event program for her. There is a QR code on there. All of the resources that were here tonight are listed on SnohomishOverdosePrevention.com, and you can get there through that QR code. So don't feel like you forgot somebody, like if you didn't grab a flyer or a brochure from somebody, it's all listed on that site so that you can refer back to it later. Again, wanted to thank everybody for being here. Just a logistical mention, if anybody has to use the restroom, it's down the hill across from City of Everett. Just in case, because there's nowhere else where there's restrooms, but I know somebody's probably wondering. Oh, sorry, I thought somebody was talking to me, squirrel. Okay, so I've been doing this event. I've been fortunate enough to do this event for the last 8 years with Kathy Lee and Debbie Warfield, who started this. I butt my way into it because I wanted to help amplify their voices, because I think that their mission is so important. The stories of their families are so important and people need to hear them. And so I wanted to bring Hope Soldiers backing to elevate what they're trying to do. And we've had the honor of being part of it ever since. Can you please give a round of applause for Debbie and Kathy, please? All right, I'm gonna pass it on to Debbie.
Okay, I'm going to take my seat with Kathy over here.
Go ahead.
Okay.
Yeah.
And we'll get started that way. Yeah, it's incredible that we get to have all this nice furniture and have kind of a homey feeling. So we really appreciate that. We thought we'd get away from the podium this year and do something a little different. So once again, my name is Debbie Warfield, and I'm the mother of Spencer Warfield up here in the middle in the plaid shirt. He passed away 12 years ago, almost.
Just hold it.
Okay, all right, sorry. He passed away 12 years ago from an overdose. And that's the reason that Kathy and I started this, is just that there was really not a lot of information. We felt very secluded, shame, just didn't know how to help our sons. We went to medical facilities, treatment facilities, and pretty much we're always just sent home with, basically to deal with it. And if he continued to use, that he would be dead. So tonight we're talking about some different treatments, and they're kind of controversial. Some people believe in them, some people don't. Sorry, maybe that's Spencer talking to me. But Spencer never had a chance to try any type of treatment prior to his overdose. And I just wonder, I was thinking today, if he had, would this event, it wouldn't be here. And it's just so sad to think that there was treatment out there, but we weren't really aware of it. He was aware of methadone, but felt like it was just trading one drug for another. So he wasn't interested in trying anything like that. It's our goal for tonight and the past 8 years is to just shed light on addiction and the people that are addicted, that they come from loving families. They're no different than anyone else, that this can affect anyone. And also that there isn't a treatment that affects everyone the same. There are lots of options out there. And I think we all need to be a little more open-minded about it. So I'm anxious to hear our speakers tonight give their perspective on it, because they're in the trenches with real people that are trying to get help. And I think we all need to give them a little grace and understand that there are lots of different options, and one thing doesn't work for everyone. So with that, I will pass it on to Kathy.
Good evening, everyone. It's nice to see so many people here. It feels a little surreal to be here 8 years later. My name is Kathy Lee, and I'm the mother of Corey Lee. Corey passed away December 8th, 2015 in his college dorm room just before Thanksgiving. We spent 2 weeks in a hospital and had to make the horrific decision that no parent ever wants to make. Like Debbie and many of you, there were a lot of misconceptions and negative stigma around addiction and around drug use. Our son was young. He was in high school when he first started using drugs and alcohol, and we didn't fit the stereotype of an addict. We were told he was just having fun, he would get out of it, he was just partying, he was experimenting, and we fought his addiction alone. Many of our friends and family never even knew the extent of his addiction until he overdosed. Shortly after he overdosed, I met Debbie. She was doing a forum with at that time, the Snohomish County Health District, and they were doing a forum on opioids. I was fresh with my grief, and I remember hearing Debbie's story about Spencer and literally bawling. I could not stop, and I knew I needed to meet Debbie because her story was almost identical to mine. Good kid, good family, same desperate need for resources that just were not available. after going to a couple of dinners and lunches and frankly kind of some heated conversations about feeling like it just wasn't fair that we didn't have the resources that we desperately needed, we decided that we would start this partly for healing, at least for me, but mostly so that others don't have to go through the same grief and heartache and feeling of alone and hopelessness that we did. We've hosted a lot of programs and speakers in the past. This year, I am particularly passionate about the people that are here tonight. I hope we always have a charge or an act. We ask people to act when they leave here. My hope is that all of you leave tonight with the support, facts, and hope for you and your loved ones navigating addiction and recovery. I hope that you listen with an open mind and share with your friends and family some of the recovery that can take place. Thank you.
So with that, we are going to introduce our first set of guests. One of the reasons we picked the guests that we have tonight is because there are so many stigmas against some life-saving, invaluable programs that are in our community that are genuinely helping put people on a path to recovery. And we can't be overly conservative about how we approach addiction anymore because of the way that it's evolved so much. Fentanyl is like genocidal. It is wiping out an entire generation of people. And I weep for the children that are growing up in schools without their parents and with parents who are struggling with addiction. And so we have to throw whatever we can at the wall and see what sticks. And we got to be open-minded about it. And so that's why we are bringing these guests here tonight for you guys to hear about these programs, to hear about some of the things they offer that maybe you didn't know that they offered. And we also have some personal experience testimonies that you guys will get to hear from tonight too. So with that being said, I want to welcome to the stage our County Executive, Dave Summers, a Recovery Court Judge, Karen Moore, and then Recovery Court graduate, Amber. You're gonna sit. Yeah. Come on in. And then you guys have a mic right here that you can share. And then Dave, you and I are gonna share a mic because we're besties. All right. So, Debbie, I think you're starting us off with our Q&A.
I do.
Make sure you hold it real close to your mouth. Okay.
I'd like to just say one thing to Dave. He has supported us for the past 8 years, so we really appreciate that he's willing to, and all of his staff have been just absolutely incredible. And now the health department is under you, so yeah, they've all been great. So we really appreciate that.
Thank you.
So yeah, my first question is, we all go out to the Everett Mall and we see a hotel that's all fenced in. And just wondering what the status is on that. And we hear that it's been meth ridden. And did you know that upon purchase? And what can you tell us about
Yeah, happy. Can you hear me okay? Good. It's an honor to be here with you all. It's every year this is a really special event, and it is growing, and that's fantastic because that's our goal here is to get information out and build community, eliminate stigma, and move forward together as best we can. But in response to the question, yes, we Snohomish County purchased 2 motels in the county, one by the Everett Mall, we were close to I-5 there, and one down in Linwood, Edmonds area. They were commercial motels. We knew when we bought them that they were contaminated with meth, and so that was part of the negotiation. We got discounted prices because we knew we were going to have to clean them up, and we used federal American Recovery Plan dollars to do that. They've been cleaned up. In fact, they went through once and realized they had to do more, and so that's still underway. We currently now are in the process of looking for service providers. Snohomish County doesn't really do the work. All these great providers out here do the work. So we're looking. We're looking for. Well, that's even worse. There we go. Yeah. We are looking for service providers. We hope to open both facilities in 2025 as soon as we can. They're bridge facilities, so these are the intent is to get people shelter, but also not just shelter, wraparound services to help them move on in their life. So it's a first step type of thing, and it's several hundred units, several hundred beds. So it'll greatly increase our capacity in the county to help people and get them off the street and into services and shelter. I personally believe shelter is very important. I know we're going to talk about that, but that's the current status. 2025, we'll be getting the details out as we make contract with the providers who will actually run the facilities.
Thank you, Dave. Along those same lines, my question to you is, what makes a person eligible for that type of housing, and how long do they stay there, and what is the criteria for them to stay there?
So we consider this, and I guess my term is it's low barrier. People have to be willing to seek help and take shelter. The intent then, though, is to move them into other programs as rapidly as possible. And as you all know, every person's an individual and has their own path back to recovery and the services they need. I lost my brother last year to fentanyl. I'm thinking about his life and what he needed. Shelter was number one, but he needed some help with some pain management issues, some health care issues, some mental health challenges he had from trauma as a young child. So every person's an individual, but the intent is this is transitional. It's a bridge to more permanent programs. And I'm not sure if MJ's here, if we have a time frame or a set time, but it's certainly long enough to get people services into another program.
All right, I'm next. So I've had clients go through some of the motel programs, and a lot of the issues that I have faced is that my clients are not actively trying to seek recovery. They're actively using and they're taking advantage of these programs. And we know that housing is an issue, and I understand wanting to get people off the streets, but is there going to be some sort of a parameter that somebody has to be actively trying to get on a path of recovery, whether they're engaged in medication assisted treatment, they're in another type of treatment program or whatnot? But I just don't think it could work with people who are actively using and not trying to gain a sense of freedom from addiction.
Yeah, so this is a big debate, but I think we're really somewhere in the middle. There is not a requirement that I'm aware of that somebody would have to be clean to get into the facility. But there will be rules. there will be programs. We are not just housing people. There will be wraparound services, as I say. There'll be staff 24/7. And so these are not just housing programs. They're recovery programs and pathways back to recovery. And in this debate, this is Dave talking right now. We don't ask somebody that's sick to get better before we put them in the hospital. And if you've got a broken leg, we don't treat it out here and say, when it heals up, come on into the hospital. We get you shelter, we get you into a supportive setting, but we get the help you need. And that's the theory behind these. But if somebody's acting out, endangering other residents or damaging property, that kind of thing, they will not stay there. There will be rules.
Okay, what are the county's plans to implement more prevention?
Hold it to your mouth.
treatment?
You got to hold it real close, Debbie.
Okay, sorry. Well, you know how good I am at that. We know that Everett's providing Narcan through their emergency medical services. What's the county doing?
So we also we've also funded a program to get Narcan out to first responders and out throughout the community. That's really important that it's widely available and to the public. So the county is funding that through our programs. We're also we have a program called oh gosh, here we go. So many programs. We have a committee of resource agencies and departments and first responders to work together to coordinate all their efforts. And MAC group, thank you, multi-agency committee. Hey, it's Thursday night. Our MAC group run through our Department of Emergency Management to coordinate agencies, make sure people have what they need, the agencies have what they had, but we are getting Narcan out into the community, and we think that's really important to save lives, frankly. The first thing you got to do is save a life, and then you can work on everything else.
One more question for you.
Okay.
Are you in the hot seat?
Yeah.
Do you think emergency housing or low barrier housing is the most critical issue to address as part of the drug epidemic, or do you think there are more pressing needs right now?
Yeah, sort of touched on this already. Somebody that's struggling with addiction or is out on the street, it's extremely difficult to pull yourself up out of that. Shelter, to me, is a basic human need. Shelter, food, it's basic. So it's a absolute first point of need that needs to be taken care of, and then you can build on everything else from there. But again, we don't want to just house people. And it's complex because we need some other things. Like we're going to be asking the voters in November for a sales tax, criminal justice sales tax. One of the other facilities that is in great need is a detox facility in the county. There's one in what do we call the thing? It's in my notes. Involuntary detox. Which through the law enforcement system, somebody needs it. There's currently beds in King County. There are no other beds in Snohomish County or elsewhere. So there's a network. Every individual has different needs. Some folks respond well to law enforcement. Some folks get to the point where they do it voluntarily. We need to cover all those pathways, but do it humanely. Recognizing every person, the individual has a family, is family to somebody else. So we're trying to build out a whole system. We're also going to be promoting a rapid response so we can be out rapidly responding to emergencies throughout the county related to drugs and addiction and overdoses. Beef up our sheriff's office a bit, and we've worked really hard to integrate sheriff's office with human services so that we have teams that go out together that provide both law enforcement but also access to services. So there's a huge need that we can't fill, but we're trying the best we can. And as I mentioned, we will be asking the voters for 0.2% sales tax in November. That's 2 pennies on a $10 purchase, just to go to this issue.
Dave, thank you so much. Now we're going to shift gears over to Judge Moore and Amber. We're so excited to hear from you.
Welcome, Judge Moore.
It's so weird to hear you call me that.
Karen and I have been good friends. Our daughters have been friends since kindergarten, so she has been a very great support to our family also. So tell us about your position in not the drug court, but the family court. And tell us about what that is. And
So hello, good evening, everyone. It's great to see such a good turnout so that we can talk about some of the programs that the Superior Court has to try to engage and help with this crisis. So with regard to families in recovery, we have our Family Recovery Court as part of our overall Snohomish County Therapeutic Court program. So we have changed our name from Drug Court, which still a lot of people refer to it, to our Therapeutic Court system. And because that's really what we are. We're talking about therapy and helping people recover. So with the Family Recovery Court, we are actively working with families, parents who are have substance use disorders, are currently sometimes using, and are trying to prevent them from becoming in the dependency system. So having the state involved, removing their children, because there's a lot of research around the idea that kids being removed from their parents it's harmful to children. And so it's this balancing of providing parents with resources, support systems to keep them healthy so that their kids don't have to be removed from their care and placed into foster care. And so that's kind of the big primary thing that our Family Recovery Court does.
So what happens when clients don't meet their requirements?
So there's a variety of things that can happen. One thing I'll let everyone know is our recovery program is based on an evidence-based national model that has been fully vetted with therapeutic insight, with resources and research that really goes into how do we reach folks that are dealing with addiction. And so we have a very program that is robust with really trying to meet people where they are in their pathway to recover, and also in trying to make sure that if there is a sanction or there's something that they are not meeting with regard to their recovery path, that sanction meets the need of the individual as well as the need of the program, to make sure that the program overall has accountability to it. So we are not you failed a UA, you automatically go to jail type program. We have a very complete sanction matrix that people are given so they are aware of what's going on. And then we really have a therapeutic team that wraps around these folks with substance use disorder counselors that are part of the program. We have support specialists that can help out with having folks get education or housing needs or transportation vouchers or different things like that that they need to be able to be supported during this pathway. So it's not punitive. It is supportive. Supportive accountability, I guess, is the way I would most put it.
I think I'm here. Okay. This is probably a question for both of you and whoever wants to answer. I often hear people say, those people need to be punished and not get off scot-free in drug court. Can you tell us what a person in adult recovery court must go through to complete the process, and how does that benefit the community and victims of those crimes committed by the recovering adult?
So, yeah, going into drug court, you're looking at jail time. And that was one of my main reasons for going in there is I was looking at 7.5 years. And I was like, okay, I'm going to go through this program so I don't have to have this on my record. But going through this program, I learned accountability. I learned who I was. I was really grateful I got the counseling I needed. I am still in touch with my counselors to this day. I'm part of the alumni of drug court, and thank you. I have my life because of drug court, and I could have been put in a box and not given the help that I needed, but that's not going to do me any good, and it's not going to do the community any good. It's going through the process and getting better, and then being able to show other people that are still in active use that yes, it's hard, but you can get through it. It's accountability. Accountability it's still to this day so big for me because I didn't know how to be accountable for my actions, and now I am, and I'm doing great.
Just briefly to kind of address the question of what does the program look like? It is not a cakewalk, and I would never say that a recovery court participant who actually graduates got off scot-free. There's folks here that have worked through this program, and it is work. The program is anywhere from 12 to 18 months long. In the beginning, you are going to court every week. You are going to treatment every week. You are going to referrals for mental health court. You are going to referrals for drug and alcohol counseling. We require folks to either have a GED or a high school diploma for them to graduate. They have to have housing. They have to have employment. They have to have at least been completely UA clean and free for 6 full months. So it is not a program that is easy. And specifically our program, we really focus in on high risk, high need individuals. So we are trying to take, not to label anyone, but kind of the people who are really the worst of the worst, the most at need and most risk, to provide them with that therapeutic team so that they feel hope and that they know that they are not a lost cause, that they can get through this, and we're all there for them. But it is not easy, right? No.
I love hope. Amber, I didn't get a chance to meet you before this because I was obviously distracted, but I'm so glad that you're here, and I love learning about you and the hard work that it's taken for you to get to this point. Did you experience any setbacks when you were in adult recovery court, like, did you have to at any time get sanctioned for anything? I love the transparency and rawness about you, and I just was wondering if you could just keep it real with us. I mean, there's a lot of people here who have been through it and are in it currently, and I think it'd be nice to know.
I did get sanctioned. I got 6 months added because I went to Red Robin and had their honey mustard, and it has poppy seeds in it. So it came back positive. My UA came back positive, and at that time, they were still putting us in jail. I graduated 2 years ago, and I went to jail for 4 days because I ate something with poppy seeds in it. But at the time, I was angry. I had just gotten my kids back because I didn't have my kids, but through the drug court process, I was able to get them back. And I had just gotten them home. They've been home for a week. And then I get called into court, and they're like, your UA came back positive for opiates. And I'm like, that's not right. No. And I gave them my receipts and everything. And I was like, see, I went out to eat with my dad and my daughters. And they're like, well, you should have been watching what you're eating because that's one of the rules, right? You got to watch what you're intaking because there's a lot of rules. But I was okay with the fact of going to jail. I was like, yeah, okay, I did. I messed up. And so I called my CPS worker and I was like, so I'm going to jail for 4 days. And she was like, okay, and what are you going to do? And I was able to put my kids in a safe place, and I went and did my jail time. I got my 6 months added, but I'm honestly grateful that I got the 6 months because it happened for a reason. I watch what I intake now, and I don't eat poppy seeds.
Yeah, I guess you don't mess with muffins at all, huh?
No.
So I just want to ask you one last question, because one of the things that's really important about this event, having you all here, is letting people know that there is hope. And I just wondered if you could share what are some of the gifts that you've gotten because you went through this program successfully and you are living in freedom from addiction. What are some of the gifts that you have today that you get to enjoy as a result of your hard work?
I have my daughters back. I have an amazing life. I work with the YWCA. I work at the Homeward House. I'm a parent ally. I have a future, and it's crazy because even before drug use and everything, I didn't see much of a future. I saw I'm a mom. I'm gonna be a mom. This is what I'm gonna do, and because of recovery, I have a future. I talk about it all the time, and I can make plans and I can keep them, and I have a life now. I have a life, and it was hard to get here, but I am grateful for the people that I know today. I'm grateful for every day I get to wake up and see my kids, even if I sit on the edge of my bed sometimes and go, I really wanted this. I love my kids. I'm grateful for it. I'm grateful for it.
One more question for you, and if it's too personal, it's fine. I heard that in what you were saying, you said you went to dinner with your dad and daughters. I just want to know, how was your relationship with your family before drug court, during drug court, and then after?
My relationship with my family during drug use and stuff, I tried to distance myself because I was ashamed of myself. I stayed in touch with my kids as much as possible, but still at a distance. During drug court, they were my biggest cheerleaders. My kids were my biggest cheerleaders. Still to this day, they're my biggest cheerleaders. It's right there. My oldest daughter goes to CWU, and she is double majoring in psychology and social work. And she thanked me for being an addict. And she was like, Mom, without you, I wouldn't have known what I wanted to do with my life. And I was like, I did it all for you, honey, don't worry. I have a great relationship with my daughters. They can come to me with any question. We're totally open about everything. Drugs, they come to me and they're like, Mom, I'm really worried about this person and what they're doing. And I'm like, okay, well, you know, let's get some resources together, and you can give them to your friends. And I love having this open communication with them. It's the most beautiful thing, and they go to drug court with me to this day. I love it. It's a family. It becomes a family at the end and even afterwards.
Thank you guys so much. Can everybody give them one more round of applause? Thank you, Dave, Karen, and Amber. Thank you so much. You guys didn't hear this, but Amber just was like to Dave, I'm sorry, I think I stayed in one of your hotel programs. Okay, we're going to change gears here, and we are going to welcome the physician from Therapeutic Health Services, and Ronnie, who is going to share his personal experience with the methadone program. So would you guys give them a round of applause as they come to the stage? Hey, nice to meet you. Go ahead and take the mic. Do you want to just state your name, your position, and a little bit about yourself?
Yeah, my name is Ben Ross, and I'm the program manager at Therapeutic Health Services. I've worked for Therapeutic Health Services for 27 years. I mostly work out of the Everett location, which is down on Evergreen Way. We have currently 900 plus clients that come and get their medication. Not every day. Some people come a few days a week. Some people come weekly. Some people come monthly, just by how they progress through treatment. So it's sometimes you hear this, well, I have to come every single day. Well, that is a thing that they do have to start that way, but they don't have to end that way. So that's a little bit about me.
So there's been a lot of talk about methadone. I know I was working trying to get a clinic in downtown Everett, and it got opposed because people don't want that kind of stuff in their backyard. So can you tell us really what is methadone, and hasn't it been around for 50 or 60 years?
Yes, methadone is a synthetic opiate, so it's not something that's made out in the world. It's made in a lab. It's a medication that someone can take who's has an opiate use disorder. They can take it, and once they take it and they have a stable dose that they can maintain without having any withdrawals for over 24 hours, which allows them to do pretty much get back into their life, because when you're in your active addiction, all you're focusing on is not being sick, and nothing else matters. So your whole life is centered around my next time I'm going to try to get well. Jobs, housing, that's not a priority. It's about getting the funds that you can maintain your wellness. Most people that come into treatment, they say, you know, I'm sick and tired of being sick and tired. I'm ready to take the leap. A lot of people have kind of looked at me like, why do you want to get on that methadone stuff? You're just going to be a crutch or whatever. They're saying, well, what am I doing now? I'm a crutch to this opiate that's this fentanyl that could potentially kill me at any time. So I need to do something. And that's kind of the first step that most of the people that are coming in each day are seeking, and it's all depends on their motivation. Everyone asks me, well, how successful is methadone? Well, it depends on the individual. What's your purpose with the methadone? Do you just want to take it and just keep using, or do you want to use it as a tool to get well and get on with your life? And methadone's been around since the 60s. It's actually started in Washington in the early 1970s. Therapeutic Health Services has been around since 1972. And we have locations in Seattle and Bellevue and Shoreline and Everett. And we're potentially growing to Kent and also mobile unit. We're in the process of getting a mobile unit to go around to the tiny homes in Seattle.
Well, that's a segue into my next question. What are the restrictions for methadone for physicians, for primary care physicians? Why do we have to have them in one brick and mortar place for everyone?
That's a good question. A lot of people have asked me, why don't I just get this from my doctor and then I'll be great. I don't know if it's just because we've done it that way for so many years in a brick and mortar facility. That's why we're trying to get into the mobile. You'll hear a lot more about mobile units where people are now taking the methadone out to the community, because it is hard for a lot of people who are in their early stage of addiction to get to a clinic every single morning. Our hours in Everett, we do go to 3:45, which is a lot longer than some of the clinics that end at noon or before that. So, but also think about someone who just doesn't know where they're sleeping each night to try to figure out, okay, I got to get up by a certain time to get to a clinic by a certain time. And if I don't get to the clinic, I'm not going to feel so well, and then I'm going to go out and use. So, yeah, there is sometimes that barrier of that. So that's why the mobile unit is something that we're really looking into. But the restrictions for the physicians is the DEA only allows physicians to give out methadone if you're actually, for someone like for pain, and it can't be a long term. If someone has chronic pain issue, they have to find a pain specialist. Not any kind of primary care can just give out methadone and say, okay, here you go, and treat your pain. You have to go to a pain specialist. And we can't actually treat pain in the clinic. It's actually for substance use disorder. So if someone comes into the clinic and says, I have a pain in my knee and I need methadone, I'll say, well, I have to refer you to a pain specialist. We can't prescribe methadone for you.
Just a quick comment, and I'll be the devil's advocate. This seems like such an oxymoron, because the whole reason for the need for methadone is due to opioids and over prescribing from physicians.
Yeah, I think that's why they kind of opened up Suboxone for primary care doctors to now all doctors can prescribe the Suboxone. Before, it used to be just certain doctors had to take a certain course before they could actually prescribe. It's now changed where any primary care physician can now prescribe Suboxone, which has a less chance of overdose risk because it does have the naloxone in it. So if someone tries to abuse the Suboxone, it kind of works in reverse, which doesn't feel good for the individual who wants to abuse it. So that's, with methadone, they could overdose. It's still an opiate, and it still could be something that someone could take and take too much of it and overdose. So that's kind of why it's controlled a lot more than the Suboxone.
So how does someone get started on methadone? What's the process?
Well, at our Everett location, we do have walk-in days. We have walk-in days on Tuesday, Wednesday, Thursday between 7 and 8. Anyone that shows up between 7 and 8 will be seen. 90% of the time, they'll see the doctor that same day, and they'll get their medication that same day, which is a relief for a lot of clients that are coming in. They're like, oh, great, I can get my medication today. I don't have to wait till tomorrow or next week for my first dose. This week, we've had 20 walk-ins. So just for our Everett location, we had 20 people walk in between those hours on Tuesday, Wednesday, Thursday, and they all are on the program as of the end of the day on Thursday. And we do that. Some days there's 15 people walk in. Some days there's 2. We just doesn't matter what day. Sometimes it just depends on sometimes the weather. Sometimes it just friends will grab each other and say, we're all going to the clinic, and they all get in their car and they all come over to the clinic. So we're making it a lot easier. When I first started, it was kind of like you had to show you had so many years of using. You had to show track marks if you were an IV drug user. You had to do all that. Now you just come in. You have to show some signs of withdrawal, so the doctors do a physical to see that you're actually going through some signs of withdrawal. And then they'll prescribe it, and then you can go see the nurse right away, right after you see the doctor. And it's all in the same clinic, so you just walk in and we can do it all in the same facility.
All right, let's do one more question each from you for Ben, and then I want to shift gears over to Ronnie here. Hey, Jack, can you bring a black XL or L hoodie down for my guy Ronnie? He's over here shaking like a leaf. Yeah, go ahead.
A lot of people in the community, especially in neighborhoods, are against methadone clinics. It appears that there are clients standing around outside. Again, sometimes it's the not in my backyard. But what do you say about changing that image of methadone clinics?
Yeah, that's a good question. It happens a lot where people will come in and, we have people in all different levels of their recovery. So you actually have people that are still actively in their addiction that will still continue to behave in those behaviors. And, when you put a lot of people together in one place, they know a lot of people, and then they want to hang out with, it's my social hour. I get to hang out with my friends, and we all meet up at the clinic. Other times you have to understand too, if I was a drug dealer, where do I go? I go hang out where the drug individuals are. So maybe I'll get a sale if I stand around or sit around or wait long enough. We try to continue to we have parking lot, we call them community liaisons that kind of walk around the parking lot and around the block to make sure people aren't doing those kind of behaviors. We tell them to move on. People that come into the clinic, they all have to sign a code of conduct, which means that I'll behave appropriately in the community, around the clinic. And if not, you can be discharged from treatment. We try to work with the individual first. It's not like, okay, we saw you once standing on the corner, now you're going to be gone. We bring them in and we talk about, kind of the image that you're projecting to the community. We want to be good community members, and we want to show that this program is really going to help you and change you. And so that's kind of it's ongoing. We hear it all the time. And a lot of times, they're not really, sometimes they're not even clients. They're just people that hang out because they've known people around and they park close to our clinic. And hopefully one day they'll decide to come into our door and actually get the help that they need.
So for the last question, how does someone get off of methadone, and how long do people typically stay on it? And people are saying they get addicted.
Yes. Well, most people are addicted already before they come in. So they're already addicted to an opiate. So they move to methadone, which is a controlled substance, which is a medication. It is an opiate medication. So you don't just stop taking it. So it is a process where people have to kind of slowly taper off, and everybody has their own feelings on how they do it. It's controlled by the individual. We never tell someone, oh, sorry, you've been here too long, you need to be off the program. It's all individual. Some people will decide that methadone is the way of life that I'm going to have because I don't want to go back to that lifestyle, and this has maintained my life. I've got a job, I've got my family, I've got a house. Why mess with it? And I try to explain to a lot of people, sometimes it's like the scenario of someone who's diabetic. They need to take insulin, and no matter if they exercise or eat better or whatever, they still might have to keep taking the insulin to maintain their life. Same along with the medication. it's all individual, so it just depends on the person. We'll never like say, sorry, you can't be on this anymore, unless they're doing some kind of behavioral problem or situation like that. And it takes a time. We don't say you don't recover in a day, and you're not off the methadone in a day. Sometimes people come into the program thinking they're already thinking about getting off before they actually get on. I say, well, let's get you stable before we start talking about getting off the program, and then we'll start working with you to slowly taper off the program. And some people take a few years. The younger you are, we've seen success with the younger kids who haven't been on opiates very long. They have a better chance of kind of tapering off. People who've been using for 20, 30 years, it gets a lot harder to taper because that's kind of all they known. And a lot of times the opiates have kind of messed with their endorphin center and their serotonin levels and things like that, and they can't produce those on their own anymore. So this medication allows them to kind of feel, quote, normal. That's the kind of the feeling that we get from people, and they tell me is, I feel normal now. I don't feel high and I don't feel sick. I can now function like my neighbor and my friends and all that, and I can do the things that I need to do to get my life better.
Ben, thanks so much. You're welcome to stick with us here. Really glad that you were able to share that information. Again, like, there's just a lot of people that think that the methadone clinic is a problem. I mean, you hear about in the news if a new clinic is coming up, there are people that literally protest it. I've done it. I've been a protester of it before, but that's because, 10 years ago when they wanted to put another methadone clinic in Everett, I didn't think we were at the point where we needed it. We're there. We can't exclude these options from people who are in desperate need of support and services. And so my mind has been changed because I've known people who have gone through this program and I've seen it work for people. So thank you again. So I want to introduce Ronnie, who has gone through the methadone program, and he is an incredible testimony of what success looks like on the other side of methadone and addiction. And so I'm going to pass the mic over to him, but I'm going to ask you a question and then just take your time. But basically, I just want to know, like, what we talked about on the phone the other day. Like, walk me through what your life looked like up through the point of getting on methadone, and what did your journey through methadone look like? Like, what was the process for you, and how long did it take you to get to the point where you wanted to do something different?
My name is Ronnie Larry. My life was, I was hooked on heroin, and pretty much, well, cocaine and heroin were my two drug of choices. My whole life was focused on criminal conduct because that's how I supported my addiction. Lied, cheated, stole. I went to prison, juvenile prison, was in Green Hill. I spent about 17 years off and on, been to every major institution in this state. I tried a geographical change, moved to the Midwest, went to several prisons in the Midwest. My mom was an addict, my brother's an addict. I moved to Illinois in 2003. I came back here 2012, and my sister was giving me money so that I could stay well. And one day she told me, I can't keep giving you money, you need to go get help. And so I went out to THS in Bellevue. It was the only location that was accepting clients. I got on methadone. For me, I needed structure. Been through drug court, graduated it, did the alumni thing, but still got high. Couldn't get it together. So I came back, went to THS, I got on methadone. They give you, like the gentleman was talking about, wraparound services. They ain't for everybody, but I participated and jumped through the hoops of their program, but for me, it was structure. Like, I needed that structure in my life. Like, these people standing over me telling me, do this, don't do that. Do it this way, don't do it that way. And a lot of times I didn't like what they had to say. I got high probably twice in my first 90 days. And then I went like 9 years without getting high. And I'm still, focused on not getting high. Thank you. I decided that after about 9 years, right before the pandemic, I had a conversation with my best friend, and I said, what if they declared martial law right now and I couldn't go get my methadone? I'd be sick as a dog. And that's when I decided it was time for me to get off. I was at 86 milligrams. Took me 2.5 years to get off. 1 milligram at a time. Sometimes for 3 months, I'd have to stop and get my body to kind of level off. But the methadone program allowed me time and space from the drug. And it was a hard decision because that drug was my best friend. Like literally, that was been there with me through the hard times, through the good times. That drug was always there. So it was a tough choice to say that I'm not ever gonna go hang out with my best friend again. Like it was almost like, yeah, it was a loss. But once I did it and got stable for a while, I understood that I didn't want to get high anymore. Like, I would see the people at the clinics, I would see the dealers, I would see the people on the bus. Some people would take enough that they'd be nodding on the bus, like, wow, you're really here to get high. And that's the only thing that would go through my mind, like, you really want to get high? And I didn't. So I stayed away from everybody. I had a good, supportive, adopted family. They loved me and nurtured me while I went through the process. They paid the bills. I didn't have that responsibility to worry about for a few years while I got myself in order. I went to school. I went to Renton Technical College because I'm a criminal. The only thing I can do is like manual labor, right? I have a record. Not anybody's going to hire me. And so I went to, got my associate's degree, 2020, graduated, and was a Ford mechanic for about 3 years. And once 7 years passed, I knew that I was eligible to go work anywhere. Work in the airport, can be a TSA, check person. And so now I work for community transit. I drive a bus and I engage with people that look just like me, every day. And it's such a good place. I never thought or felt accepted in any job that I've ever had. There's been a lot of firsts for me. I've just completed my first lease on my apartment in July. Never had an apartment before, never had a home before. First, I've been with community transit for 19 months. That's a first. I've never had a job for longer than a year. it's an organization where I walk in the door and it's like family. As soon as I walk in, everybody's saying hi. It doesn't matter what color you are, what size you are, what your gender is, or your gender preference. Everybody just like embraces you. It's like a big family. And I never thought that I would find that coming from where I come from. You know, I always think I'm being judged.
Real quick, can you tell me what it says on your hoodie?
Hope.
So I just want to thank you so much for being a beacon of hope tonight, because people need to hear stories like this and know that they can come out of generational trauma and addiction that runs in the family and have all the odds stacked against them and be in and out of incarceration and continue to make mistakes over and over and over again and probably think, you know, am I worth anything? But you are. You're worthy of love, honor, dignity, and respect. And you believed in yourself and must have had some amount of faith and probably a sliver of hope. And you were able to get into a program and stick it out with all the bumps and bruises that you probably faced and get to the other side of it. And now you get to be a light in this community with people that you see that are struggling with addiction currently, and you get to tell them your story and say, if I did it, you can do it too. And I just want to thank you for that. Thank you both so much. Thank you so much, Ben, for the information, and Ronnie, thank you for sharing your personal story with us. It really means a lot. So thank you guys, and we'll do one more round of applause. Thank you guys who are still here sticking it out with us. I know it's cold and we got hoodies for sale. I'm just saying it's cold, but you guys, so grateful that you guys are here. We do have one last set of guests that we want to introduce. We're super thankful for this program and we're excited for this conversation. So do you guys want to go ahead and introduce them?
So, April and Josh, for Ideal Options, come up and tell us about your program.
And then Christina and Zach, will you please also join us to share your personal experience about this program? You guys go to the couch. Yeah, and then...
So April, do you want to start and tell us what Ideal Options is?
So my name is April Provost. I'm the Community Outreach Manager for Ideal Option, and that's just a fancy way to say that I get to go around and make partnerships with other service providers. Ideal Option is what we call an OBOT. It is an office-based opioid treatment. And that means that we operate much like a primary care doctor or any other doctor. Folks come in that are suffering with substance use disorder and we put them on a medication track to help them titrate off of the substances that they're using. That can look like something as short-term as the detox period, or that can be a continuum of care. So it's medication-assisted treatment, MAT. It's also known as addiction medicine. And it's a piece of the pie for somebody to start a treatment plan. Most of the time we want to get them free of substances before we really start digging into the meat and bones and those exterior supports, counseling, and other treatment programs. So we're the kind of the first step.
So, John, with the microphone, can you tell us what your function is at Ideal Options?
Yeah, I work as a physician assistant at the clinic in Monroe primarily. I've been with a company with Ideal Option for about 11 months, so still pretty new. I grew up in the area, so it's been cool to kind of reconnect in this area, this community, and see how much things have changed really in the last 20 years since I lived here. But my primary role as an addiction medicine provider is meeting with patients and trying to decide what an appropriate medication is. Priority being, almost everyone we see is struggling with fentanyl use. So it's how do we find a medication that helps you stop using fentanyl? So trying to find a viable option, which is more often than not is buprenorphine or Suboxone, as far as what Ideal Option offers. But that's kind of where it starts, is just getting a sense of where the patient is, what's a realistic option. Can we get you in inpatient treatment and detox? A lot of people, that's not a great option. So trying to stabilize that person long enough so they can get connected with some resources and counseling and all the other stuff.
And so we heard from THS. So how does Ideal Options differ from THS?
Yeah, I love hearing about THS. So there are some differences between methadone and buprenorphine. Methadone's been around much longer. It's a full, we think of it as a full agonist opiate. So it fits on the opiate receptors in the brain quite nicely. Buprenorphine is similar. It's a partial agonist opiate, which is, not to get into the weeds, but it has a really unique property for an opiate, and it doesn't have increased respiratory depression risk after certain doses. And most people who stabilize on the medication, it's prescribed outpatient basis. So we start out generally seeing people twice a week. Once they're stable and they've stopped using fentanyl, we see them weekly. And then we use urine drug testing to make sure they're taking the medication. And a big part of that is letting people know, because as I'm sure most people here know, fentanyl's kind of everywhere right now. So even if someone's just using methamphetamine, which kind of sounds silly to say that, oftentimes they find out for the first time that, hey, there's fentanyl in this, or the cocaine or something. They thought they were just using this, but it's everywhere now. So that's a big part of what we do, is just trying to establish rapport with people. Very low barrier. I love hearing that language at an event like this, is we're going to meet you where we're at. The drug testing we do is never punitive. We never punish people. It's always driven by patient safety. So that can look different ways for different people, but for the most part, in this context, it is fentanyl use still just being kind of everywhere at this point.
How many clinics in Snohomish County do you have? And if I called today for myself or for a loved one, how soon would I be seen and start recovery?
Great question. So in Snohomish County, we have 5 clinics: Montlake Terrace, Everett, Marysville, Arlington, and Monroe. We have 27 clinics in the state, and we have roughly 16 on the I-5 corridor in Western Washington. So it's pretty easy to access. Most of our clinics are Monday through Thursday, with the exception of Everett. Everett is Monday through Friday. And generally, if you call for an appointment, depending on the location, we can get you in sometimes same day, but almost always within 24 hours, at most 72 hours. So 1 to 3 days.
And do you take insurance? Are you Medicaid? Are you vouchers? How does payment, if I wanted to go?
Absolutely. So we are contracted with most of the MCOs for Medicaid and Medicare. We are contracted with most of the private insurances. And then for those that kind of fall in between the gaps or are underinsured, we have a self-pay option of $150 flat fee per month. That covers all Ideal Option expenses, your toxicology, so your UAs. It doesn't matter if you come in once a month or 4 times in the month. It's a flat fee.
And so what is kind of the timeline someone stays on these drugs?
So it's much like what they were saying with methadone. It's really patient driven, and it's going to be driven by what are their needs. Some people want to titrate off very quickly, and we are going to do that with them. We're going to work with them to make sure that they do it safely and that they have built up enough external supports to support coming off of that medication. Other people, they've been using for decades. They may need to stay on that medication. And if that's what they need to maintain a positive, purposeful, successful life, then we're going to work with them to make sure that that happens. A lot of people titrating off has been difficult. We hear it all the time. Oh, it's that last titration, but we do have injectables. So buprenorphine does come in an injectable format now. And we've seen people be much more successful when they use a Sublocade injection and titrate off using that because of how it stores in the body for longer. And it's a little more seamless for them, but I will let Josh speak to that as well.
Just make sure you hold the mic super close and talk loud. We're at max volume, and I don't think people at the top can hear very well.
Yeah, not uncommon to see folks who've been on Suboxone like methadone for several years. And it's not easy. Just, you shouldn't stop taking the medication. It is an opiate. People will experience withdrawal symptoms and cravings. And that's kind of what we're always checking in on, is the reemergence of those cravings where someone's recovery can be jeopardized in a moment. So fentanyl also sticks around in the body for a long time. So when people are starting out looking at urine drug testing, which can be kind of monotonous after a while, you see it can take 6 to 8 weeks for fentanyl sometimes to be non-detectable on the urine drug testing. So as far as April mentioned Sublocade, it's a monthly injectable, so there's multiple options at this point. That can be really effective for coming off of the medication, but much like methadone, I think it was Ben who said, we're always checking in with the patient. It's always driven by patient safety, how they're feeling, and whether or not they've been able to make those connections so they can sort of establish and maintain long-term sobriety, which is building supports and getting a counselor. We're always pestering people about counseling, which takes a while to find a good one, but it makes a huge difference. So we want to try and support our patients through that process, which can take a while. So we're always checking in. So it doesn't look the same for everyone as far as how long you're on the medication, but we want to meet people where they're at.
One more. How many patients do you see per year, and what is the long-term success that you see with Ideal Options?
That is a great question. So one of the things I truly appreciate about Ideal Option is every year we are not forced to do this. We are being transparent with it. We publish a patient outcomes report. So we had our 2023 patient outcomes report. We publish it for the company-wide because we are in 8 states across the nation. So we have the national data, and then we have our state data. So for the last census reporting was between 16 and 17,000 people are enrolled with Ideal Option across the country. So 40% of our patient census comes from Washington State. So roughly half of that for Western Washington. So Snohomish County is I think 10% of that roughly. So we have 1,500, 1,600 in Snohomish County that at any given time on our census. If we can get a person to make it to a third appointment, so they onboard, they initiate, they go and they do their checkup appointment a few days later, still in initiation stage. Once they get to a stabilized therapeutic value, usually by 3 or 4, if they can make it to that appointment level, then we have, I believe it's a 96% chance that they go on to a long-term recovery. So it's really about keeping them engaged. Most of our folks are falling off after that first or second appointment because they don't have the other supports that they need, or one of the most common ones is they're not sheltered. So they have no stability, and it makes it very difficult to follow a program.
I just wanted to quickly ask you, we talk about medication assistance. We heard from the methadone clinic, so we know about methadone. We know a lot of us know about Suboxone. We know about buprenorphine. Can you talk a little bit about the value of Vivitrol? Because I feel like there's just not enough mention about it. And it really does help. I mean, not even just for opioid, but people who are coming off of alcohol. It can benefit multiple different substances. And I just wanted to see if you could speak to that really quick before we change gears.
Yeah, Vivitrol or naltrexone is a very effective medication for, you mentioned alcohol use disorder. So folks who are able to detox, we do offer ambulatory outpatient alcohol detox, which is very challenging and very dangerous. But if people are able to go through that process and start naltrexone or Vivitrol, it can be very effective for cravings and long-term sobriety for folks who are wanting to avoid alcohol use. It also is very effective for opiate use disorder. It's often not our first choice if someone's actively using fentanyl, because basically naltrexone is an opiate blocker. So by starting that medication, you become opiate naive. So if someone were to return to using opiates, which is not uncommon, we see that as a normal part of recovery, they would be at a higher overdose risk. So if someone's been stable on Suboxone for quite some time and they're looking at that as an option, we're more likely to encourage that. But starting out, as powerful as fentanyl is, at least in our setting, buprenorphine or Suboxone is almost always the safer kind of preferred option for folks.
Thank you guys so much. Really appreciate it. All right. I'm super excited to also hear from Christina and Zach. So I've never met these people in my life, but Zach was eating teriyaki and I got a piece of his chicken. And so that's the bro right here. And Christina, I've been asking her, is my Facebook Live still up? And she's like, yeah, it's still up. And so thank you both so much for your generosity to me this evening, and I'm excited to ask you guys some questions. So, Christina, what did it look like? What'd your life look like before Ideal Options, before medication-assisted treatment, before your freedom from addiction? What did your life look like leading you to this path of recovery?
How far back do you want me to go? So I'm one of those decade-old users. I basically got involved in drugs when I was not even 20. I have fought this battle for about 25 years, and I can finally say today, like yesterday, I celebrated 25 months clean. That's literally the longest amount of time I've ever had sober in my whole life. So it's definitely taken a lot. And my life before this, I was in and out of jail, prison. I am not welcome to anywhere that is like any kind of place where, you know, you deal with the cops. Like they all still know me. They all still watch me, which is fine. But my life, I feel like it's a dream almost. Like where I used to be to where I am today. Like I don't even recognize that person anymore. Like it's a totally different life. And, you know, I just got to a point where I was bound and determined to do something different. You know, I lost out on a lot with my kids, you know, and it's horrible what we do to them, you know, not even realizing what we're doing to them. And I just got to a place where that was more important. Like my desire to be in their life and be a better parent was more important than me being on the streets selling dope and getting high. So
thank you so much. Thank you for that. All right, Zach, same question. What'd your life look like before you got on this path of recovery?
I'm Zach. I'm an addict. Hi. So my life, God puts us in situations, and I feel like I'm here today because I've been through every program that has been talked about. I tried methadone. I was on it for 6 years. Ended up not, and I held a job and apartment and things while I was on methadone, but I lost it when I made some wrong choices. I've also tried Suboxone many times, but never like I just used the medication as thinking it was the end all be all. And that was, you know, something that I know is not true today. But I wouldn't be here without the medication. So my life looked like constant jail. I've been battling it also for 20 years before I got clean. 12, 14, 22 is my clean date. Yeah, I've been I was constantly in Snohomish County, constant in every jail around here, with no ability. Like, I just got back out and started doing the same thing. I had no hope. I thought that what I was destined to be was just a criminal, and this in an addict. This was what the hand I was dealt, and I better do the best I can with it. And it is what it is, and that's a really sad existence. It's a really dark existence, and it wasn't until Ideal Options came into the jail and I started on their program. And the doctor and one of the other ladies came in and actually were so nice to me. Just that connection with them, how they believed in me that I could do this, really sparked something in me. Like, hey, maybe I can do this. And I got out, and I'm in the drug court program also. That's what I'm saying. I've been in all these programs, and my life today is 100% different. I have hope. I'm clean. I'm in a union. I have a car. I have all these things that recovery gives us, but it wasn't until I met the people, my family right there. You know what I mean? That's how I stay clean today. I was able to get off of Suboxone. I was on it for about a year, and then I took the Sublocade shot, and I walked away, very easily. And that was a shock, because every other time when I would stop, I would go right back because I didn't feel good. You know what I mean? And so, yeah, it's possible. It's very possible.
I love that. Thank you so much.
Can I ask you, so you're not on anything now?
No.
No, that's
Yeah.
That's fantastic. It makes me think of my son up here. I wished he had that opportunity.
Absolutely, and I'm sorry for your loss. And the moment I got here, seeing all these pictures, it was like, it hit me that I was in and out of jail constantly, and all it took was that one time. All it would have taken is that one time to get out, because I constantly went back right to the same thing. And because of this medication, I got out this time, and I was like, well, it's not going to work anyways, so I'm not going to do it. I ended up doing something else, you know what I mean? But I went to treatment the very next day because of drug court, and been clean ever since.
That's fantastic. Yeah, congratulations to both of you. It's incredible. Really nice to hear that there's hope and recovery does happen.
And Christina, you're still on your journey, and I just want to say, there is a myth that if you're on medication-assisted treatment that you're not clean, and I want to outright tell everybody here that is a lie. Being clean is about the lifestyle. It's about the work that you put into it. It's not about what stepping stone you need to take to get out of the pit of addiction. And I'm glad that the recovery community is starting to really embrace people who are on medication-assisted treatment, because I would much rather have somebody on medication that's alive than somebody who was told that they weren't clean if they would have taken something and then they overdosed. So thank you both so much. I just want to ask you both, you talked about a little bit about the gifts of recovery, and I asked this to, Amber earlier, and I want to ask you guys each too, what are some of the gifts that you guys have today that you really cherish as a result of going through Ideal Options, getting to the other side of addiction, and whatever your faith looks like today? And why do you look so much like Morgan Wallen, by the way? So would each of you mind sharing about your gifts? And then you guys both totally go get a Hope hoodie after this. My treat, okay? Yeah. So, Christina, go ahead.
All right. So I can't even list them all off. There's been so many gifts, but the return of my family, like my mom's here today supporting me, like she shows up. I did get a lot of tough love from her while I was in and out of incarceration, but I also don't blame her because, as a parent, you don't know what to do sometimes. But I got my family back. I'm holding a steady job. I'm about to be a GM at a hotel down here on the waterfront. That's just an amazing job. I get to walk into work with a beautiful view every morning and people who really believe in me. I also have a lot of services that entail into my life, mental health treatment, mental health. I check in all the time to that, and then I get to hang out with my family. My family is really important to me. I don't know if you can tell, but being around my family has really given me motivation. Sponsors, treatment, meetings, all that. All of it together encompasses just the amazing things that I have today. And the best gift that I have is life. Honestly, just having life. I am so happy that I, like he said, didn't take another turn, because it could have very, very easily happened. In fact, I was hoping that it would happen. There were days I was praying it would happen. And, we were all just one decision. And I'm so thankful that I'm here to be able to tell my story and share my story with other people, help get them into treatment, help to do the things, and just spread this, message to everybody so we can reach more people and save more lives.
For me, more than the materialistic things and all that, I'm free today, and I'm free to discover who I am. I don't have to put a mask on anymore and pretend that I'm this other person. I really get to discover who I am, and that's the biggest gift. All the other things, though, I'm a productive member of society. I have a career, a license, insurance, a beautiful relationship, a beautiful family, truly meaningful friendships. And that's what keeps me clean. We're all clean. We all attend the same program, and that's a big suggestion of mine is with the treatment is also find a program. AA, NA, CA, any of the programs, go find your people, and that's what's going to keep you clean for the long term, it's just my life today is I'm not committing crimes. I'm not constantly in jail. I get to be somebody else who I always knew I was and who other people saw, but it was just so far put away with addiction, and I just kept running from it, that I actually get to experience who I am today and keep working on being a better person.
Can I ask you? We've heard tonight from, and this is a very personal comment or question to you, heard tonight from several of you in recovery, and I hear that you needed someone to believe in you or to give you that opportunity. I know Debbie and I and our families did everything we possibly could, and one of the biggest things for me to get over after my son passed away was that feeling that I couldn't love him enough out of addiction. And what do you say to your mom and your family that is now your family? At what point did you realize that, like Lindsay said, that you were worthy? And we were all standing in the wings loving him and doing anything we could. I guess question is, how did you not see that, especially from the people that loved you the most?
So I want to say that it absolutely wasn't about you guys, and no amount of love can ever change somebody. My mom put me in treatment when I was younger. She did everything she could, so please don't feel guilty about that. Absolutely, you can have all of the help in the world, or you can have none of it, and you will still end up in the same place. I can't say the pinpointed reason what made me change. It was accumulation of my whole entire life going to shit, but I had to find out who I was and love myself in a way that I'd never done before. and in prison nonetheless, where there's nothing but hopelessness around you. You know, I just knew that I wanted something different, and not to wake up to a cement wall every morning asking myself how I got here. You know, that was so, like, no matter what happens in my life today, all I think about is at least I'm not in prison. No matter what, at least I'm not in prison, you know, because it could always get worse to that point. But, you know, and there were times where my mom wasn't there and she wasn't, you know, supportive. Like I said, there were times where she had to step away too. But you just have to do it and want it for yourself. You have to be the person that makes your decision. Once you do truly make that decision, it is so much easier to seek the resources and seek the help and accept the help. You know, you can't get it forced on you. Trust me, I tried to get it force fed to me and it just didn't happen. But at the end, when you do make that choice, having that help there, having that support there that has been waiting, has definitely helped me carry through my recovery. So.
Thank you for your honesty.
That hits home because I had adopted parents that tried everything, and it would work sometimes, but I was so numb from the drugs and things that I had going on, and the hurt that I had, that there was no way. It kind of pushed me further away in a weird way. And I only can speak for myself, but the greatest thing that my dad ever did was move to Montana. You know, he said, hey, you got to figure it out. And it took 9 years of really being out there and really causing some wreckage and some consequences. But through that, I got to be here today. You know, so there really isn't no amount of love. I had to hit the gift of desperation is what I have today, and that's what got me clean, and just finally being done because of it took what it took. You know what I mean? But my mom she passed away from dementia, but I got to be at her funeral clean. You know, and she knew. I spoke to her, you know, a few months before she passed away, and my biological mom would tell her all the time, like, Zach's clean, and she got to see that, you know, I feel like, and I got to be there, and, you know, he's just so, my dad, who's still in Montana, is so proud of me, and, but yeah, there's nothing they could have said or did. It was, I just had to figure it out, you know. But it was the drugs. It was the drugs. Absolutely. It wasn't me. It wasn't us. We were numb from the drugs. It took over, and as an addict, like that's all it took for me was there was nobody going to save me. No love, no amount of love that could bring me out of it. I just didn't feel, you know, and I was totally numb. So.
Thank you.
Thank you so much. You guys, before we close, totally forgot to ask if anybody had questions for the other two groups. Some of them are still here. I just wanted to ask if anybody in the audience does have a question that they would really like to have answered before we close. Feel free to raise your hand and I can come to you. Does anybody have any questions at all? Okay. You guys, thank you so much. Can you please give a round of applause for these folks right here? Thank you for being here. Thank you for sticking it out with us. I know it's cold. We're really grateful that you guys could be a part of this tonight. Again, Hope Soldiers is here to help people find freedom from addiction as well. We also try to help you find your purpose in life. So thank you again for being here. Thank you to Dave and the Snohomish County government and all the staff that helped us have this successful event, all the resources that were here tonight. Thank you so much to Courage to Change for getting people to detox if they needed to go and for providing the sound system. Thank you so much to Isabel and Steve from Modern Home Furniture for supplying the stage setup. It's just absolutely beautiful and really like helped make this a special evening. Thank you to everybody that was here tonight and helped make this a success. And if anybody needs to talk, if anybody needs a hug, if anybody needs a prayer, I'll be around for a little bit. So thank you again, everybody.
So much. You guys nailed it.